All right, guys. Good morning, everybody. We're going to be talking today with Jordan from HealthSherpa. Jordan, good morning.
Hey, good morning, Luis. Great to see you.
Yes, it's been a while. We're going to talk about ACA 2026. And I will tell you, we got a lot of changes that are coming down from higher towards us agents on what is happening with ACA, the SEP changes, the EAPTCs going away. I mean, there's a ton of stuff that is happening that's going to make ACA tough for the next couple of years. But Health Sherpa is kind of got some tools that are going to help us with it. So, Jordan, why don't you kind of give us an update on what's happening in the ACA world and Health Sherpa with all these 2026 changes that have come down from CMS that are getting pushed to us agents.
Yeah, great question. There's certainly a lot that's going on. I think, over the past couple of months, everybody's been joining the webinars out there. I know the carriers are putting them on. HealthSherpa has been putting on webinars. CMS has been putting on webinars. So there's been a lot of talk about the changes, and we've seen a handful of these already start to go into effect. We know that SEP verification started to take place back in May for loss of coverage. We know that there will be additional SEP verifications heading into next year. We also know that starting the 25th, the 150% FPL SEP is going away, and that's going to be a big one for a lot of people. But the rest of the changes are primarily around, how will I plan for open enrollment? How will I process my renewals? And how will I handle all of these changes, plus the other requirements that CMS has required over the past several years. So we've got consent being a requirement. Last year we had invalid action. So for those of you that had to navigate that, if you're processing an AOR change, whether it's a client outside of your book of business or even if you were used to using NPN override and now that's gone in Florida, just a lot of different changes to navigate. And the most important thing is, well, how do I prioritize my time? How do I know that I'm doing the right actions? And how do I make sure that I'm getting in touch with everyone in my book? So, certainly a lot of things to cover. And I think the most important thing right now is that renewal prep has to start earlier this year. It can't be a October, can't be a window shopping. Okay, it's game time. It's a, hey, it's almost September, which is crazy. And I need to get moving and have my action plan going now.
Here's one thing I'm telling agents is you've got to find a way with the passive renewals not being a good thing going forward. If you're not prepping right now for that, it's not going to be a good thing. And here's what's happening on passive renewals. If you just let your policy for your insured just renew, then if they end up with a $0 premium, they're going to add $5 to it. Not you think it's not a big deal, but these guys are used to not paying a penny. They're going to see this $5 bill and like, whatever. Well, in a couple of months, it's going to cancel. Now, in the past couple of years, it's been kind of easy to manipulate the system and restart it. Well, that's not going to happen anymore, guys. Now they're going to end up with no insurance. So we've got to figure out, hey, we don't want to not let these policies passively renew. And what I mean by a passive renewal, guys, is that means that you don't touch it. You don't do anything. It just renews automatically. Okay. Well, now you're going to want to touch them. You don't want to talk to that insured. You're going to want to update the application. Even if you just go next, 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 you're still actively renewing it, and then you're good to go. So one of the things I'm telling agents is you got to either staff up, and there's two ways to staff up because you can't do it all. If you're going to focus on your book, you're not going to grow. Okay. Or if you're going to focus on growth and you're just going to let your book there, then it's going to be one step forward, one step back. Not a good thing. So I'm telling agents right now is you got to staff up. Number one, you get an actual staff member. Okay. Now you just can't get somebody and they're going to start helping you because they've got to be licensed and certified to have access to their own health Sherpa within your agency. Okay. So licensing is not like, oh, it's going to happen. They got to study for the test. They got to go pass the test, apply for their license, and then go get certified. And like you said, it's almost September. October is it's around the corner. So now is the time to start doing that. Your other alternative which may or may not be a good thing, but they can help you out on the back end, is hiring a virtual assistant. Okay. Problem is a lot of these virtual assistants, the ones that where it's not as expensive, they're not local. They're not even in the US. There's a lot of virtual assistant agencies, but they hire people outside of the country. And there's no right way to get into HealthSherpa outside of the US. Is that correct?
Yeah, that's correct. You cannot access HealthSherpa or any EDE platform outside of the US.
Yeah, so you got to find a workaround and have them help you out with other things so that you can do it. So bottom line is now is the time. So what kind of tools has Health Sherpa put together to help us with 2026 enrollments and renewals?
Yeah, good question. And if it's been a little while since you've logged into HealthSherpa, Luis, I know you're in there all the time, so I know it's not you, but if it's been a while since you've logged in, I would encourage you to log in and take a look around the platform. I'll share a demo in our staging environment today. But we've been really hard at work since probably about May, focused on, building tools to prepare for all of these changes. So there's a lot of new stuff in HealthSherpa. I think you'll see that these tools will continue to evolve as we get feedback. They'll continue to improve. Our goal is to make things as simple as possible for you. But really, the focus of the team has been, all right, let's help everybody get through renewal season. So I'll shift over to our staging environment and start talking through some of those tools.
While you're doing that, guys, one of the latest changes is, and I'm doing it right now. So we've already had to deal with the 12-hour reintegrate crap. Okay. Well, now there's a two-factor setup with Health Sherpa. So not only are you gonna, when you log into Health Sherpa, are you gonna have to do this two-factor, but you're also gonna have to reintegrate every 12 hours. So that's the latest feature.
Yeah, and I'll just add to that, these things are here to protect your account security, enrollment integrity. We are not adding tools to just make your lives harder. Know that, please. Whenever possible, we work with the team at CMS to help them understand the impact of any of the changes that we're required to implement, like the two-factor or the 12-hour FFM integration. So our hope is to make it as easy as possible for the things that we're required to do. But please know that we are not implementing these things to make your lives harder. It's all focused around account security and enrollment integrity.
And I just did it right now. It's a 1 minute process. The
Yep.
authorization, the two-factor, and then your integration. It's a click, 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 click. You
Yep.
get your codes on your phone, you plug them in. It's really a piece of cake.
Yeah, absolutely. And I would say, if you're having trouble with any of the new features, if you need to learn more, we've got a great training and education department. We're offering everything in English and Spanish. My team has a ton of agency resources as well. So if you're a new agency or an existing agency of HealthSherpa and you need some more support, please don't hesitate to reach out to our agent support team. You can reach out to Luis. He can get in touch with me. I'm always happy to help get you pointed in the right direction. So if you need help, please leverage the resources that you have access to through our teams.
Gotcha.
All right, so let's jump in. I'll share a couple of things today. So I'm in our staging environment. This is our test environment. It's fake client data, so not sharing any PII here. I'll cover a couple of examples today from both an agency perspective and an agent perspective. These tools work for both. So if you're running an agency, you've got access to some different, business level tools. And if you're an independent agent, you have access to many of these tools as well. So we're starting in the agency tab here. So over on the left, and you'll see that we've started adding these additional navigation bars. So the first one we're going to talk about today is tasks. So if I click into tasks, this is where I can see across my full agency book of business, things like client follow-ups, invalid action, renewals, um, and some of these new features down here we're testing right now. So I'm not going to cover those today, but I want to start with renewals. So I mentioned before, a ton of work has gone into renewals. So if you've been in HealthSherpa, you've probably seen many of these already live in the product. But what we are doing is helping you segment out your book by who is going to require action, who are we recommending that action is taken, and who's been actively renewed. So in years past, as you navigate renewal season, you know that you have to look up your client in HealthSherpa. You go through the active renewal process. And if you don't actively renew them, then after open enrollment, you have to use the search marketplace to look up that record and pull them in. So one of the, pieces of feedback that my team has shared with agencies is a good way to audit that is pulling your book of business export, looking at, so for last year, you could pull plan year 24, and then you pull a report of plan year 25, and you want to make sure you don't have any gaps in there. Well, the goal in this is we're going to try to expose all of that in product so that you're not having to navigate different spreadsheets or knowing, okay, did I miss a client anywhere? So we're going to be providing tracking within the product for this. So from the client view, this is what you'll see. You'll see your clients' names, the renewal status. Again, these are tied to these sections up here. So if you click on view, it'll filter the view on the specific segment that you're looking at. We're going to give you these different renewal follow-ups. So hopefully none of these are a surprise to anybody. They've been around for several months now, but things like the $5 premium may be due. So those are your $0 members. Tax return access denied. So if you hover over these, we'll highlight a little tooltip of what this means. So this example, the client denied CMS access to their tax documentation. They may lose their subsidies if this is not resolved. So we're flagging these things in the product for you, and you can filter by what specific, item you want to work on. So as you think about heading into renewal season, which should be starting, as soon as possible, you can come in here and say, all right, well, maybe I want to focus on carrier exit. Maybe I wrote a lot of Aetna business last year and I want to focus on those members first. Well, I'm going to filter here and then I'm going to export out this client list, which is going to give me the phone numbers and names of all these clients. And Luis, I know you've got a great CRM system, so you're going to drop them into an automation in your CRM that's texting these people saying, hey, Aetna's leaving the market. We need to look at a new plan. Please schedule an appointment so that we can make sure that we're enrolling you in open enrollment in a new plan.
Hey, Jordan, when you click on that carrier exit, does it automatically just start the filtering process when you do that?
Yes, it will. So
Okay.
if I remove that, I can show you some other ones here. So let's say we want to look at, so that was carrier exit, $5 premium maybe due. So it's going to show us all of those here. It's also going to flag income near 150% FPL. We don't know yet what's going to happen with the advanced premium tax credits. We'll know hopefully later in September. But if they're not extended, then you're going to have to look at your clients that are near 400% FPL because they're going to see some pretty big changes too to their premiums. So you can filter by that. So this is a really nice way to really segment out your book of business. And if you want to have different, messaging campaigns for these different segments, you can come in here and filter those lists accordingly.
Now,
Uh,
one thing that I'm just caught my eye, number one, you are correct. On when I go to carrier exit, oh my goodness, I got a good chunk in there. So I created a workflow that's already letting my Aetna people know. Now, I didn't go this route because I didn't know about this, Jordan. I went to my Aetna, pulled my commission statement, saw all my
okay.
people, and then just started, and filtered out that way. It was a little harder. This is much easier to do it this way. But the one that I'm seeing here, the income near the 150, can you explain a little bit on that one? I mean, I have an idea, but my assumption here is this. Let's say that the 150 is for a single person, the 150 mark, I've got it here. Let's say that is 15,000 and change. Well, next year, this is probably going to be maybe 15,500. So they're going to be below the minimum number. They're going to lose subsidy. Is that what this means?
This one is actually, so if you hover over the tooltips in here, so if we hover over this, the client's income is near or below 150%. Now, it's important to know that what we're looking at here right now is looking at plan year 25. Once we have the rates in the product for plan year 26, you'll go through window shopping. Once it's open enrollment, you have to reprocess their eligibility information. So some of this will change. The goal of this is highlighting where they're at today. So just know that it's not looking at plan year 26 yet, but this particular segment, we know that they are more likely to trigger an income DMI next year. So for those that are in this bracket of getting, fully subsidized coverage, they're more likely to trigger an income DMI than they have been in years past. So really my recommendation here would be if you do not have income information on these clients, that should be an absolute requirement. Just collect it for everybody in advance of open enrollment so that if it triggers a DMI, you already have the paperwork and then you don't have to follow up with the client to get it afterwards.
Yeah, and I would say the ones that are near the 400%, guys, if you don't know what's going to happen, this is the cliff. Okay. So if you're like, what are you talking about? A cliff. So with the enhanced APTCs, they removed the cliff, which means when somebody got to the 400%, it dropped. It was a gradual downhill where they got less and less help. Well, now if they're $1 over that 400% mark of the federal poverty level, they go straight down. This is not gradual, they fall off. And what I mean by falling off on that cliff is they go from getting help to getting no help. So these people right here, and I just clicked on it and I'm like, oh, I have 25 pages of this, which at 10 per page, 250 people that are getting some kind of assistance now that next year will not. So they're going to pay full premium. That's going to be a little eye shocker, okay, for these insureds. So you need to have a game plan. Hey, let's look at your income. Let's see if hey, where do you think it's going to be next year? Let's get a little more accurate on this. Oh my, yeah, it's going to be crazy.
Yeah, and again, I think the important piece there, Luis, is that's if subsidies are not extended. So if they're extended, you're not going to be having that conversation. I think the other thing to think about, and again, this is why these tools are so important, is that if premium tax credits are not extended, this impacts everybody in the market. So we're going to see premiums go up for everybody. And so that's where having the ability to segment your book of, okay, if you have a $0 plan, and now there's no longer a comparable $0 in your area, that's an entirely different conversation. If you've been on, you mentioned this earlier in the call, if you've been on a $0 plan for the last 2 to 3 years and now all of a sudden you have a non-$0 premium, you have to be prepared for that. You have to make sure you've got payment information on file. You're no longer managing somebody that's not making payments. You're now potentially having to chase down payments if they go into grace period. How do you know if they've gone into grace period? There's just all of these additional things that you as the agent have to now be responsible for. So understanding these tools and being able to look at your entire book of business and have the right messaging for your clients is really important.
Jordan, there's a question here that's good. So if somebody has an individual account, they're not seeing this agency tab. Is there another
Yeah,
way to
so
access it?
yeah, the way that you'll get to this if you don't have an agency is you'll go into your clients tab. And then within the clients tab, you're going to go into your client follow-up. So you can see you've got all of these up here. So there's a lot of tabs in here. One of the things that the team's working on right now is consolidating a lot of this to make it just easier to understand, where to go to take action. So the client follow-ups is going to encompass everything like DMIs, SVIs, renewal risks. The place you'll start right now is renewals for this. So here's the same view that we were just looking at. So if you're part of an agency that has shared clients, you'll see this toggle minor shared. You have that same export. So if you're using a CRM system, you can pull out a contact list there. Same filters down below. Yeah, a couple of other things down here. So if you click view details, it'll just bring you right into the client's account. When it's renewal season, it'll allow you to start your renewal flow right from here. And then I did want to share also within the agency view, if we go back, we also provide you insights. So let's say you want to track how everybody is doing across the agency. Here's a great high-level view of how the agency is doing. So if you have just one agency, you'd look at my agency. Let's say you've got a sub-agency, you can include your aggregate. we're going to show you the different segments. So action needed, recommended, and renewed. So again, talking about understanding what percent of my book have I already renewed and what still remains. You can click into these and it'll bring you to the list that you need to work through. And then, Luis, I think this will be probably really helpful for you. So if you go into, again, I'm in agency and then insights and renewals over here, we're going to break this down by all of these different factors. So depending on the book of business that you have, you may want to prioritize these differently. So you just mentioned you've got 250 Aetna clients. Those should be at, I would say, the top of the list. But then working through some of these like tax return access denied, they're not going to get subsidy, so you're going to have to get in touch with them. So building out your plan based upon these different factors. And as things change, so if we find out that another carrier is leaving the market, we're going to put them in here. If there are other things that come up, we'll put them in here so that it's really simple for you to have a high level view of what's going on in your book.
Yeah, this is great. Yeah, and I would tell you that taxes that you pulled up, super interesting. I've been dealing with calls now. Hey, my premium went up from 0 to $800. What happened? I go in there and I look, and I was thinking, well, now I can at least tackle it maybe ahead of time with this tab, but they're losing their subsidies if they didn't file their taxes.
Yep.
I'm like, who doesn't file their taxes? I mean,
Yeah.
I know
And
some
that
seniors
changed.
don't,
It
but
changed from it used to be 2 years you would lose your subsidy. Now it's 1 year. So your clients need to file their taxes. If they're planning on getting subsidy dollars, they have to file a tax return.
so 2024, they didn't file. There's a trigger being pulled up.
Yes.
Or is it 2023? How, maybe
So it's switched to it was 2 years, so that would be 23 taxes in 24. Yes. And
okay.
then next year it'll be just 1 year. So if they didn't file their 25 taxes, they will lose subsidy eligibility.
Wow. Oh man, is it getting
Yeah.
tougher?
And what's tricky, and you'll see this as you start to navigate some of these new tools, is that CMS will send out letters, and we know that sometimes clients read them, sometimes they don't, but you can see the letters in HealthSherpa. So if you're looking in a client profile and they received a letter from the marketplace, you can open up that letter and you can read what it says. It's a little bit confusing because they sent out some letters on tax return access denied, and they had the same subject line of either like, hey, you will lose your subsidy, or hey, you've lost your subsidy. So again, if you see a notice in there that's new to you, I would encourage you to open that up and read it because it's possible that they've already lost their subsidy effective August 1st, and you need to have a conversation with them about filing their taxes.
And yes, I will tell you, let's say you go in there and you fix it for them, they still have to pay that August 1 increased premium. There's no way to backdate it. So what you're fixing is for September the 1st. So yeah, not a good thing, but it is what it is.
Yep. So this is the renewal segment here. Again, lots of new features in here. We could spend time going through all of the other agency tools. Um, I would like to go into some other renewal features. So let's go into our clients here. So a couple of other things we've been focused on. So first, you can start with segmenting your book of business. So that's really, I would say, step one, like understand your plan, look at your book of business, and I think you'll be able to very clearly understand, hey, am I going to be able to renew this? Do I need to hire somebody? What's my plan? Then build your strategy for contacting all of these different segments. And then once you've started contacting them, what does that look like? What do I need from these clients? Do I need to get income documentation because they're near 150% FPL? Do I need to start looking for changes? Luis, I know that you use your CRM for sending out text messages and whatnot, and you've got some great tools for reminding them what to bring to their appointments. So we've built some additional tools. I would say that in the next couple of weeks, we'll have more that we'll be releasing in terms of bulk actions that you'll be able to take across your book of business. But some of the cool ones that we've done recently, you can find here in the client table. So here you have the ability to collect documents. So if you've been using HealthSherpa for a while, you know that if you generate a DMI, or now if you have an SVI, a SEP verification issue, you would be able to upload those documents after the enrollment. And so that's just one more step that you have to take later. We've built the functionality for you to collect these documents in advance. So if you are storing them in your CRM, you can upload them to HealthSherpa and we'll keep them within the client profile so that if you do generate that follow-up following your application, you can just submit them right then and there. So imagine you generate a DMI, you already have the income information, you submit it, those follow-ups are now done and you can move on. Versus in the past, you see, oh, shoot, I have a follow-up. Well, your client didn't bring that paperwork with them, so they say, I'll get it to you when I get home. And how often are you having to then call them and remind them, hey, I still need that paperwork? So you can collect these documents outside of the enrollment. You can do that here. So again, just real quick, I'm in the clients. You can click this drop down. You can collect documents, or you can now send an intake form. So we just launched this intake form. This is pretty neat. So you send this out to the client. So I'll click on this example here, update the email. It'll show them, what the message says. You can include additional information. Maybe you want to say, please include your income information in the uploads. Thanks. And then send this off. And I already did this one earlier, so we'll open this up here. But the client would receive this intake form. We're not allowed to tie it to the actual application. So it's just going to be a blank form asking them for updates. So it's going to ask them, were there changes to your household? Did your phone number change? Any of the things that you need to update on the application. It is gated by their date of birth. So that was intentional. Obviously, they're submitting PII. We want that to be a secure form that's going to them and being sent back to us. But it's not, asking them for their social and they're like, oh, I'm not going to do that. I don't know who HealthSherpa is. So really easy way for you to collect any changes to the application.
So Jordan, now I'm going to talk a little bit about best practices on these changes, and then I'm going to hit you up with this SEP verification. So one of the things that I'm doing, guys, and I built this out on the CRM, is I took eligibility notices for my clients and I pulled out or I carved out the page that shows all the documents that you can submit for maybe citizenship, income, non-Medicaid or CHIP or Medicare coverage. There's about 7 different verifications. What I do now is I always try to collect, I look at the eligibility when I write somebody, and if it says I need this, well, I have them on the phone. Jordan, hey, go get me your pay stub right now. Okay. And I try to make it super easy, guys. So I tell them, just put it on your desk or whatever, take a picture of it with your phone and text it to me. Then I email it to myself. I upload it to HealthSherpa, and then they send it to CMS, then that integration, and then I save that document. So I want to take care of these eligibility requirements on the spot if you can. Now, it does happen a lot where they don't have access to it. Okay, that does happen. I put them into a workflow because they do forget, and then you move on to your next client.
Right.
So I put them into a workflow that will text Jordan, will text and email her and say, hey, Jordan, hey, you owe me these documents. We need to have them, or otherwise you're going to lose your coverage. You're going to lose your subsidies, whatever the deal is. And I try to kind of put a little more impact into that text and email. And then I try to collect that specific document. So either try to collect it up front, try to collect it, you're going to forget. It just happens. Make sure that you have a workflow or something automated where it's going to bug the heck out of Jordan to give me that whatever I am needing to satisfy the requirement. Otherwise, you're going to lose a client, guys. Jordan's rate's going to go from $100 to $500. She's going to cancel her insurance. When if I had just bugged her a couple of times because life happens, I could have got that document up front. Okay, so remember that. Now, Jordan, let's talk about SCPs. So there are some SCPs out there that we have some time to submit the paperwork afterwards, but then there's some where the insurance won't start until we submit it. Can you talk a little bit about that?
Yeah, great question. So let's actually go into, I'll do this from the agent view. I'm going to go into the exports tab. So this is where you can find all of your reporting. So there's 2 different follow-ups. There's SVIs, which is a SEP verification issue. And then there's DMIs, which is a data matching issue. So SVIs have not been around for the last, I think, 2 to 3 years. So we haven't had to deal with these. They're now back for loss of coverage, and heading into plan year 26, they will be back on for any qualifying life event. You will have to show proof of that qualifying life event in order for the client to have that SEP. So when you submit the application, if again they're being granted a SEP, you have to show proof of that. So it's going to generate an SVI. So we've built reporting now to help you track this. And this is super important. I've actually had quite a few calls about this over the last month or so, where they say, well, I've submitted the application in HealthSherpa, but it's not in the carrier portal, and I don't understand why. It's because there was an SVI, and until you resolve the SVI, which you have 30 days to do, the data is not even sent to the carrier from CMS. So you have to resolve the SVI within 30 days. And once it's resolved, then CMS sends the 834 file off to the carrier, and the carrier will backdate. So let's say that we did, an application today for a 9/1 effective date, and I don't resolve the SVI until September 10th. The coverage will be backdated until to September 1st, but not until that paperwork is submitted. So essentially, the client is not going to get, their coverage or anything until that SVI is completed. So this is really, really important that they need to just be bringing that paperwork to the appointment or giving it to you at the time of enrollment because they need it for their coverage to go into effect. So for those, again, I'm in the export tab here. We're going to scroll down to SVI follow-ups. This is a pretty simple report. For those of you that are not familiar with our reporting, I'll just navigate over to our FAQ and I'll show you how to read these reports. So if you go to faq.healthsherpa.com, this is our FAQ, and we've got an article for everything in the product. So if you go to the export reports, this is where we have all of the different reports that exist. So there's agent and agency, and then we have legends, which explain, what all the columns mean. So we would open up the export legend for agent users. And again, these are slightly different, agent versus agency. So if you're pulling the report for your agency, you're going to want to go to the agency legend. And then if you go into the tab for SVI follow-ups, you'll see what the report looks like. So here we've got all the column names. So application submission date, the FFM app ID, the SVI type, the status. So whether it's pending or it's expired, you'll see that, the due date. So that's super important. We'll give you a link right into the client details. So if you download this report and then you've got these documents already in your CRM or in your email, you can click this link and then upload them there. And then the plan year that the application is for.
Are the SVIs right now tied to just loss of coverage? Or is there another SEP?
Just that right now.
Just that right now. Okay.
Yep. So again, for plan year 26, they'll be requiring documentation for all SEPs.
So here's what we've had in the past, guys, is loss of coverage without documentation. Now, pretty much, you need to submit documentation. Otherwise, it's not going to go forward. So this is truly going to curtail enrollments outside of the open enrollment. So again, I think this is making ACA extremely seasonal, just like Medicare.
Yep. And then just briefly on the DMIs, these have been around for a while, but still important to understand. So the difference between the SVI and the DMI is that the coverage will not go into effect if you don't resolve the SVI. Again, it won't even be sent to the carrier, whereas the DMI, the coverage does go into effect. You have 90 days to resolve the DMI, but if you don't resolve the data matching issue, then the client loses their subsidy. And what happens when they lose their subsidy and they get a $900 bill?
I'm going to be mad at you. And I will tell you, here's the beauty, and this is another great feature on HealthSherpa, is you get an email, guys. Okay? You get an email. It comes in every Tuesday. Now, Jordan, I will tell you this, and maybe your tech people can work on this. I get mine. I'm like 9,000 lines deep. Now, I do sort it by the year, and it's going back to 2017. So I get rid of all of the DMIs, which are data mismatch issues. And I just copy my 2025 one. So maybe they can get rid of the past years, because what is 2017?
Yeah,
What do we need that for? And then the other thing that would be good is, so once I remove the past years or the previous years, I'm still left with about 3,000 or 4,000 in there. And I've got the completed ones in there. again, if they're completed, why do I need to see that on
Yeah,
the
right. That makes sense. You just want the ones with action needed.
Yes, action needed, the
Yep.
expired, and I think there's one more. I don't need the pending. The pending means it's there.
Mhm.
Oh, the insufficient.
Oh, yep.
Yeah, I think those would be maybe if there was a way to filter it. Now, what I tell agents, look, get that email. You got to log into your HealthSherpa, and then it will extract that, open up your email, and then you do your filtering, and you're left with a list. And then you work that list, guys. So the good thing about that list that HealthSherpa sends us, it's got the category. So you can even put that into your CRM and workflow it, where it sends that person, hey, look, if we don't get this, your rate's going to skyrocket because they're going to remove your subsidy. Please send me your pay stub. If it's an income issue, your pay stub, your 1040, your 1099, send me something so I can get it in.
Yeah, I'll share that feedback with the team. I'll call out too, important that if you have feedback like that, click this little feedback button, tell us how you feel. But after this page, you can actually send a message to our team of, hey, it would be really helpful on this feature if we could have, XYZ. I always tell everybody to fill that out because it goes directly to our product and engineering team, and they do read those. So fill out this feedback button when you can. I'm going to go back quickly to the export legend. So on the DMI point, so Luis, you just said it'd be great if you could filter it. That emails, I think it sounds like we can make some improvements to that. You can also, at an agent or agency level, download your DMI follow-up report. This will give you a CSV, which you can filter. It's going to give you the DMI type. So if you're running an agency, you're going to want to look at your agents. Do you have an agent that's always generating a citizenship DMI? What information are they not asking for? This can be a great tool for making sure that your agents are all consistent, they're asking for the right information, they're doing the applications correctly. Is somebody missing a social security number on their applications? So again, helpful report here. You can filter it by the status. So this would be really easy to just filter by those statuses that you want. You can also sort it by the due date. So you can work it through, those that need action the soonest. And then same as the SVI report, you've got your client detail, URL, obviously plan year, you're focused on plan year 25. And then,
Jordan, it may be me. Maybe there is a sorting feature and I just don't see the little button to click. I guess maybe there's
I think
like
the
where it says
email.
G, if you could click on the letter G in the column, I wonder if it opens up a little window where you can just choose 2025.
Yeah, it probably depends on what application you're opening that with on your computer. I know I'm on a Mac and it always defaults to numbers, which is not a useful tool for me. So I have to save everything and then open it up in Excel. And then I would filter from there. But, again, you can get everything in this DMI follow-up report and you can pull the same report at the agency level. So if you've got a couple of agents underneath you, pulling DMI follow-ups and SVI follow-ups has to be a part of your weekly workflows to make sure that these are being resolved and that your agents are taking care of everything that they need to.
I agree. And I'm going to go with that teaching tool. If you get one agent that's pulling up a bunch of citizenship, well, maybe he's not asking, are you a US citizen when you're doing the intake? Maybe he's dealing with a lot of people who are green card holders or maybe have some kind of legal immigration type. And by asking up front, you can reduce you don't create an eligibility because you enter the right data. So it saves a little headache on your part and their part. So I like that. A training tool. I never thought about that.
Absolutely. So again, this can be found in the export section. If you're running an agency, you're going to go to the agency tab and then you'll go to your exports here. So same reports, just in a different area. All right, so let's go back to, so we talked about you have the ability to send out a request to collect documents in advance. You can send out the intake form. Now, if we click into this client, we can see when this page loads, we have the ability to request documents from here. So this is new. So you can send that out. Let's see, a couple other things I'll point out on this page. You can upload consent outside of the application. You can do that through the consent library as well. We already talked a little bit about enrollment history. So if you're seeing, you've got enrollment history and then the CMS notices will be in that section as well. And now if I scroll all the way up to the top and we go to documents, here's where we can see any documents that have been uploaded. So I uploaded a fake screenshot earlier. We could see that in here. We're going to make changes to this where you can categorize these. You'll eventually be able to rename them. So, I think naming conventions are important. If you're saving it to your computer, you might want to just say this is their 2024 tax information. So it's really simple to see in here. And then eventually we'll be able to rename those or delete them from here. But you can upload them to the product. If there's a follow-up required, then you can map it off to that afterwards. And then you'll also be able to, so you can send from here as well. You can send the intake from here.
Hey, Jordan, when you
Yep,
when you send the intake form to a client, is that I haven't used it. Is that a generic email? And can you say, look, Jordan, I need income verification. Can you please upload these following documents? Let's assume that you put a pay stub. When you receive that, when they upload that pay stub, does it get put into where the upload section on HealthSherpa?
it does. So here's an example. So I'm going to send this to myself. Let me open that up real quick.
Okay. So I'm kind of doing it harder right now, but still doing it on the back end where I collect it and then I upload it. But if I send this intake form, I eliminate a couple of steps.
Yep, exactly. So I need to, so it's going to be gated by their date of birth. I've already opened this one, so let's see if I can share this screen here.
So a couple of things while she's doing that, guys. Number one is the SBIs. Again, insurance is not going to start if you don't submit those documents beforehand. Secondly, DMIs. This is your book of business, guys. You got to make sure that you're maintaining that book. Okay, you worked hard to put them on the books. Now we just need to collect that one document to satisfy the requirement. It's just like I said, I like what Jordan said. It's a weekly task. One of your people. Now, if you're thinking, hey, well, you can VA this. This is a good thing. So I use my VAs to contact the DMIs. So I will send the VA, hey, here's the list. Here are the phone numbers. Here's the contact information. And I have a VA right now calling and collecting that and sending it to me so I can upload. Because she can't get into my HealthSherpa. But that is definitely a task that you can set up with a virtual assistant.
Yep, absolutely. Right, so here is what it would look like if you send the intake form. So they're going to see your information is secure and protected. If they need help, it's going to reference your HealthSherpa account. So Luis, if you sent this, it would say call Luis. And then the phone number that's listed is the one that's in the marketing tab of your HealthSherpa. So that's the number it's referencing.
Okay.
So they'll enter their date of birth and it will bring them into the form. So this is what it looks like. So again, I mentioned that it cannot pull the information from the application in, but we tried to make this very simple for them to understand. Has my phone number changed? If yes, they're going to fill it out here. Tax household has changed. So they're going to add their household members if that's changed. Other health insurance, my address, estimated income, and then here's where you can upload documents. So let's say you do want to collect their income information. You can just type that in the email and that note will display here. So again, they can upload the document here or say they want it. Let's say that I'm your client, Louise. I could say, I'm moving in November. So now you're going to have a note of this to make sure that you get that new address when I do move. And
Gotcha.
once you submit, it'll just say your form has been submitted and that's it. And then it will display in HealthSherpa back
So let's
in.
say they had a baby. And I didn't find out about it, and they added the baby on it. Will I get a notice? Hey, Jordan just had a baby. I need to add the baby, or will it automatically add the baby and push it through the application?
No, it's not going to automatically do anything. This is just intended to help you start collecting this information in advance of open enrollment. So when you think about, contacting your full book and making sure that you're doing active renewals, this is just a tool to make sure that it's all in one place. Because, currently what you can do is you can edit the application if they have current changes, but then come open enrollment, you're still having to go back through the application. So if they're estimating that their income's going to be different or, whatever that household changes that you need to know about during open enrollment, we're collecting that in the intake form.
Okay.
All right. And then I was looking for the intake form. Here's our marketplace notices. I'm trying to remember where we display that, but we give you the ability to track the intake form. Okay, so it looks like we show when it was sent. The goal with the intake, and I know we'll need CMS approval with this, but we collect the intake and then show it side by side in the application. So that's the ultimate goal of if your client fills out that form and they say, hey, I'm going to have an income change, that when you're processing that renewal, we're going to show it on the side of the screen so that it's very simple for you to see, okay, I need to make sure I update this section because we know that you're going really quickly and we want to make sure that it's easy in plain sight for you. And then it just reminds you, hey, I have to update this section. So more to come on the intake section there.
Okay.
A couple other things that will be helpful that we've launched as well. So one of the tools that we've had for a couple years is what we call our Premier Partner. So we've got a handful of carriers live with that. And what the Premier Partner is, let me see if I can give you an example here. You've likely seen this little icon in the product. So a Premier Partner is a carrier that has integrated with HealthSherpa, and they're giving us a 24-hour policy status feed. This is really, really helpful because they're going to tell us who the current agent of record is, what the policy status is. So whether it's effectuated, it's been canceled, if they're in grace period, we're going to highlight that. And then if they are in grace period, we're going to tell you how past due they are, what the amount is that they're due. So heading into this open enrollment, not only are we working with the carriers to try to expose passive renewal data in the product to help you understand, okay, who else do I need to pull into my book? Maybe they passively renewed for the last 2 years and you don't even have them in HealthSherpa. We're going to do what we can to help flag that. But when you toggle over to Premier Partner, if that carrier is a Premier Partner, we're going to show all of that data here. So I would encourage you to check this out. We'll be up to, I believe, 70% of total carriers will have this by open enrollment. So this is really, really helpful when you're doing your commission reconciliation because you can now pull a report from HealthSherpa that has this data that comes every day from the carrier. It's going to have the carrier's policy ID, and then then your carrier commission report will have that same ID. So you're no longer having to map, name, uh, phone number, all of these different data points that every carrier has a different file. You'll be able to use the actual policy ID that the carrier is sending to us across 70% of HealthSherpa carriers. So this will be a huge thing. We're really excited about this. Will also really help you track down, if somebody has a change in premium, if they go past due, understanding, how much they owe and all of the details that are not always updated from CMS.
And what we have to do now, guys, is there's really no way of knowing if they're delinquent or not. And so the only way we do it now is you've got to go to the carrier websites to each carrier that you have, and then they give you the data. They all have little, hey, these are delinquent, these are in the grace period, whatever that differentiation is, but they give you that list. Super cool if we can get it here through Health Sherpa. Well, we have the ability, let's just say that one client had a $13 bill. They didn't pay it last month. It's now $26 because they owe last month and this month. Is that functionality going to be there where we can click and it takes me to the carrier payment portal?
I'll follow up on that. I know it's been something that's been requested, having a button beyond just the initial binder payment. I think it's dependent on the carrier, but I do know we've raised that with the team, so I'll follow up on that piece.
That'd be cool. Even, it may be a shortcut that takes us to the carrier place where we can. Now, right now,
Yeah.
we can't take a payment, guys. We've got to go to the carrier site and do it.
Yeah.
I try to minimize my work. And so a lot of times I'm like, Jordan, here's a number to support or member services.
Yeah.
Call them and get yourself on auto pay, please. Help me out
The other
here.
thing that, is important to know as well, one of the CMS changes coming for this next year is carriers can require past due premiums. So let's say I'm on an Oscar plan and I miss, 2 months of payment. and then it's plan year 26 open enrollment. I pick an Oscar plan again, and I have my first month payment. They can add those 2 months of past due premiums to that initial payment and require that that is due. That is part of these new program integrity rule changes. And so this functionality that I was just sharing, the Premier Partner, could be a tool that the carriers could use to display that total amount. What we don't know on that past due piece is it's really up to the carriers to determine whether or not they're going to enforce it. So that's kind of one of those things that we don't know. But again, if we're getting the data from the carrier, our goal is to make it as easy as possible for you to see. You can come into HealthSherpa, you can filter by, these payment statuses in here. So you could look at past due, unpaid binder, all of that.
Get ready, guys. This, yes, this is not going to be a good thing. If a carrier actually enforces that and they owe money to Blue Cross and you put them with Blue Cross, they're going to get a big bill. Yeah. And I don't, how do we mitigate that? I guess, are we going to know? Jordan, do you know? Are we going to know that they owe Blue Cross, a couple $100 and
Yeah, we won't have any visibility into that until probably after the application. So that's where I think, these new tools where the carrier is sending us the data can expose it. Um, but probably a conversation to have with your clients of if you had past due premiums, this is a new change in this industry that could be owed before your, or with your coverage for next year. So certainly just another talking point to have. I would say if you're not up to speed on the changes with program integrity and the big beautiful bill, have a sentence or two about each of them and understand how they may impact your client. And as you're heading into those meetings, just make sure that you're prepared to talk about, hey, is the 400% going to impact them? Bring up, if they potentially, like if Luis, you probably know which of your clients you're always chasing down for payments. Those are the ones that you're probably going to want to have that conversation with that you may owe past due premiums. So let them know there's a lot coming, that you'll help them navigate it. And if they have questions along the way to reach out to you.
yeah, it's not going to be an easy season. So yeah, if they owe money to Blue Cross, then and they don't want to pay it. Well, they're not going to get their policy with Blue Cross. So we may have to move them to another carrier, and maybe that other carrier has a higher premium, and hopefully they haven't burned too many bridges. But yeah, it's going to be. I think this is going to be the year, Jordan, where it's more of a focus on your book than acquiring, unless
Yep,
you
I think so.
really staff up and have a department that's going to handle the renewals, and then the other one that's going to handle the growth, because you're going to spend a lot of time with your book of business, and
Yeah.
it's ultimately not a bad thing. I mean, I could lose a client if I don't spend time with them, go write one, and I didn't go anywhere. I didn't make $1 more. So, taking care of your book is huge.
Yep,
Um,
absolutely.
Now, Jordan, can we? Oh, I want to. Is there any other tools here for renewals?
The only thing that I'll add is that we'll have more coming out in the next, I'd say, month or so. One of the things that we're planning to do this year that we have not done in previous years is start doing more training about the renewal tools once it is renewal season. So everybody knows that when window shopping opens up, which is typically the week prior to open enrollment, and no, we can't release that earlier. It is dictated by CMS of when we can release rates. But once window shopping opens up, you'll have access to, shopping plans for your clients, doing plan comparisons. We've never really been able to run trainings on those tools. So we'll be launching some renewal focused webinars in the coming months. And so keep an eye out for that so that we can walk you through the new functionality that we have, the bulk email renewals, how window shopping works, and all of that. And for those of you that have been on HealthSherpa for a while, you know that once it is renewal season, you'll see a renewal email button right here. You'd be able to select all your clients, click renewal email. We're looking at adding additional bulk functionality for some of these tools, like sending out the intake form, requesting documents, planning for renewals, and all of that. So more to come soon on additional functionality in the product. And Luis, when you're ready, let me know. Yeah, no problem. I'm going to check the chat here. Anyone have any additional questions?
I have a
We're-
quick question.
Yeah, go ahead.
Excuse me. So like I was bringing up a couple of them that need documents, and like this particular one, and I think you may have already addressed this, but I just want to make sure I understand. Uh, but it doesn't say what document it needs. It just says, that you need to upload the document. Um,
Yeah.
so how do you find out what it is they're needing?
Yeah, that's a really great question and something that we're looking at right now. So our product team is looking at the last couple years of data that we have, and we're hoping that we can make some recommendations in there of this is what we think based upon, previous years of what you should collect from these clients. But the other thing you could look at is, if you're looking through, let's go to the renewals here.
Like this one says, well, okay, it does say verify income. Okay. Yeah,
Yeah, so
coverage
proof of
okay.
income there. But great
Okay,
question. We're doing what we can to try to help make that easier to understand.
okay, thank you.
Yeah, you're welcome. Another question here. Do clients need to create an account on HealthSherpa to upload their documents? They do not. So through this new functionality, there's a couple things that take place. After the enrollment, you likely know that the clients can create a portal where they can see, their policy information. They can handle follow-ups there. But these new tools that we've built, if you send out the document request or the intake form, it's just going to ask them for their date of birth. The whole point of that is just reduce the friction on the consumer so that then they could upload it and then it's all set for you. So hopefully that's a little bit easier this year. Yeah, you're welcome. While we wait for Louise, I'll share another feature that we're working on right now. So you all have likely seen that we've moved the account settings. It used to be over here. So account settings is now up here, and we've added, these different tabs. Um, if you go into your carriers, you'll see that we've added some new functionality in here. So you've got all the states that you're listed in. So we started actually with Florida. Um, but we are releasing this in all states. We're now going to run a nipper check on your appointments. So you're going to be able to select your own self-attested appointment. But if we see that you have an appointment with a given carrier, we're going to pull in that status here as well. So this is another nice tool for you as an agent, or if you're running an agency, to look through and see if Nipper is sending us the appointment status on your agents. So that's new.
Hey, Jordan, I'm sorry. My wife came in. We've been dealing with an issue with an IRS, and I'm like, oh, they finally answered. But here's my question on this. I'm glad you're bringing this up. Can you explain what is happening with the NPN override? So some of us agents have an agency, we have staff, and these staff have their own account underneath the agency where they're licensed and they're certified. I've seen some emails come out where they're not going to allow the NPN override anymore, and sometimes they are. Did I miss that, or have you not talked about that yet?
I didn't cover that. I just talked through how we show in the product now we're going to pull a nipper status. We launched that in Florida because NPN override was disabled in Florida last week. We've seen a handful of states start moving away from NPN override. If you look at our FAQ, you'll see the list of states. So if you're writing in,
So let me kind of give you guys, if you're wondering what's going on. So like for me, I've got three people that help me out. They have a login to HealthSherpa underneath my agency. They can, since they're licensed and they're certified, they can talk to John Smith and enroll John Smith in a plan. And then they choose me, they override their NPN with my NPN. So I am the agent of record. I get paid, my people under salary, commission, whatever, however I have them up, and then I pay them out. So we have that. And you just mentioned right now that in some states it's already been gone, but Florida, they took away that override feature.
Yeah, so these are the states where it's gone. So a little history on NPN override. CMS approved NPN override. I think it was back in maybe 2020 when we launched this feature. And it's really every state has their own requirements in terms of, if an NPN override is allowed, or, are your agents required to be appointed if they're writing under a principal NPN? And I do think that it's possible that there were some loopholes to agencies using non-appointed agents using an NPN override. So we're seeing more states uh, remove NPN override. The best practice is, of course, everybody is licensed, FFM certified, and appointed. That's where that NIPR status check should be helpful in the product. But what we're doing now is really working with these states that have disabled NPN override to help them understand that there are some pretty major servicing implications when you don't have tools like NPN override, because you need to use that to, keep the agent of record. We know that the carriers don't currently support an agency NPN. So that's something that our team is working on. We don't have a great solution in these states right now, except if you've been using NPN override, you'll now need to have all of your agents write with their NPNs. I have heard that some of the carriers are starting to accept what did they call it?
It's commission assignment.
There was another term that I heard of. I'll get back to you on that, Luis. But basically, it's a commission assignment where you're getting paid the commissions, and then you have like sub producers underneath you that are handling servicing and all of that. So I think there will be some change. If you're writing in one of these states, know that there's going to be some additional headwinds this year if you're hitting invalid action because you now have to submit with your NPN versus an override. But we're doing what we can to work with the states on figuring out better ways to handle the servicing aspect.
Yeah, that's so I've had three people throughout or several throughout years where they've written it. And then so if for some reason I'm the agent of record, they overrode their NPN with mine. Oh, yeah, how in the heck? And I did get an email about a week or two ago from United that they're not going to allow NPN overrides in Texas. And I'm like, oh, so now I'm working on getting my people contracted.
Yep.
Because they write through United, they're going to use their NPN and they're going to get paid. I get cut out and I'm paying them a salary. So you got to make sure agents, be aware of this. Is if you're a one-man shop, this does not apply to you. But if you are if you've got an agency account set up with HealthSherpa and you've got some people underneath you that are your employees, we're not talking about downline agents. That's completely different, guys. We're talking about your employees that are your people. You pay a salary or you pay a base or a commission or hourly, whatever. And it's in the past they write, you're the override agent, you're the principal agent, you get all the money. That may go away.
Yep.
Yeah, at least in those states, it did go away. Now, Texas, kind of odd that just happened. That's what triggered my eye here. I'm like,
Yeah.
oh, oh, I got to get my
Yeah, we'll
people.
keep you posted. We're definitely looking at some new tools with, we're thinking about servicing, we're thinking about appointments, whatever we can do to,
Yeah,
help everyone understand what you need to do to be compliant.
gotcha. Guys, any questions? You can unmute yourself. On the bottom left is a little mic. Just unmute. You can ask Jordan a question. Um, just interrupt. But as I'm talking here, here's the deal. Here is my insights, me looking into the crystal ball. And hey, what do we have to do to start prepping? Is number one, is I think we're going to have to hire out. That's the bottom line. Unless you're going to go straight into servicing mode and maintaining your book. Okay. And that's fine. But if you're planning on growing your book of business, which I think you're going to have to do, because this is my crystal ball. Looking at my crystal ball, Jordan, and you can kind of correct me. I think we're going to lose about 40% of our book. Okay. And here's what I'm thinking. Reason we're going to lose between 30 to 40% of your book of business is if these subsidies, the cliff is going to affect some of these people with increased premiums. Some of these guys are just going to say, I'm out. Okay, you're not going to lose them due to other things. You're just going to lose them because their premiums are going to get way out of hand. Now, they get way out of hand, you as an agent should have some alternatives. Because if you don't, I do. And you don't want them coming to me or some other agent. Okay. So you need to have some alternatives ready to go. Although the alternatives are not really that great, you've got to have them. Some of the alternatives out there is potentially a short-term medical policy. But right now we've got to deal with a 4-month game. And I don't know if that's there. I think there's a ruling coming out soon where maybe we don't have to deal with a maximum 4-month policy, but those are fully underwritten. Okay. They're not going to cover pre-existing conditions. I mean, it's really a major medical. It's not a true health plan. It's a major medical. And with no pre-existing, no maternity, no mental health, no drug rehab. I mean, it's bare bones, but it's an option. So you need to make sure you've got short-term medical carriers in your portfolio to offer. The other alternative, which is better than nothing, is using some of these ministry healthcare sharing plans. Okay, I use it, and it's an alternative, but it's not insurance. That's the key. That is not insurance. And finally, there's the potential of maybe offering limited benefit plans, where they pay a certain dollar amount for a certain procedure. Is it gonna take care of the bill? Hell no, but it's better than having nothing. And so if you don't have a strategy for some alternatives, you're going to lose 40%. Here's another thing. For those 60% that we keep, guys, you have got to become the master of cross-selling. Okay. I know within HealthSherpa, we have the ability, and we can maybe do this at another time here, Jordan, but we have the Allstate feature. That's an indemnity company. It's Allstate Health Solutions. And you're able to offer a plan that helps these insureds meet their maximum amount of pockets, because part of the 60% that we're going to keep is maybe moving them to a less, maybe a bronze plan or maybe a gold plan where their out of pockets increase, but their premiums decrease. Okay. You're going to have to do that kind of math. And if their premiums decrease, they're happy, but their out of pockets increase, you can help meet that out of pocket with the Allstate plan. Yep. So you're gonna have to find a way to cross-sell dental and vision. A lot of these plans don't have dental and vision built into them. Okay, and if they do, it's usually for kids, and it's more of a preventative type of deal. So check that, make sure you have that. And then finally, guys, I will tell you, every single person, and they deal with it, and it's a horrible feeling when professional agents like us have a client die and we never offered them life insurance. Never took the step to offer life. And it's a horrible feeling when you have to tell that spouse that they don't have life insurance. And they look at you, did you offer it? And I love my comebacks, and I'm like, I did. And I have proof. And because we send quotes out to everybody for life insurance. So we're going to have to become the masters of cross-selling so that we can, not only round out our accounts and fully protect our insureds, but also we're going to lose a chunk of change, and we got to make up for it with these other products. So the good thing is that HealthSherpa is giving us some tools so that hopefully I'm wrong and it's not 60% that we keep. Hopefully it's 70 or 80% that we keep. Yeah. I'm hoping.
We're going to work through it. You're going to weather the storm. We're here for
it. And here's the other thing I tell agents. We're all in the same boat. It's not like somebody else has it any easier. So we're all going to have to deal with it. It is what it is. And then there's also no other game in town. It's group insurance. They either get insurance through their employer or they get ACA. That's it. Everything else is fully underwritten, and it's not a true health plan. It's less. So there's no other game in town, guys. And so insureds are just, we have to deal with it, and so do insureds. It's just not going to be a fun time. Jordan, thank you so much. I appreciate it. I know I was yapping away. Anybody have a question for Jordan? Nobody chimed in.
If you have feedback, or you need anything from HealthSherpa, please reach out. We're always happy to hear your feedback and do what we can to make improvements.
Yeah, awesome. Well, Jordan, hey, I appreciate your time. Maybe we can follow up as new updates come in.
Yeah,
Let me know.
great.
Let's do a follow up with the latest updates and start preparing, guys. Start preparing. As of right now, 2026 FFM certification is not out. It'll come out when it comes out, probably September. Okay, so stand by. I got a lot of people asking, "Hey, when is it going to come out?" I'm like, I don't know. I don't work for CMS. Do you know, Jordan? Do you have any insight? You have any date? No,
Don't
we're not
know.
going to know. But yes, when that comes out, hey, we'll get notices. We'll jump right on it. Make sure you do your certifications, your state-based exchanges. Make sure you're doing those crazy long certifications. Get them done, and that way we're prepared. Yeah, and cross sell like no other. Like your life depends on it. It's just gonna be one of those things. All right, guys. Hey, thank you for today. Appreciate it. And Jordan, thank you so much for your time.
Thanks, Luis. Talk to you
All right.
soon.
Bye,
Bye.
guys.